And when at the level of the AUA, even in the guidelines, they revise it all the times, but really they don't talk about the truth. I mean, it's very vague in terms of the options, but they do mention a lot of the pills. How can we change that language in terms of the AU guidelines or the AUA being a force to help bring that information to the patients and all urologists about, hey, we need to change the paradigm and focus on the Detrusor?
Once again, it's going to take a village. It's going to take healthcare industry reps. We need you to be evangelists. I need you going out there and challenging doctors, challenging practices. Ask them that question. Hey, what happened in the emergency room when that guy came in 4 liters? Why did that happen? And obviously, you can introduce what your technology does to help facilitate that BPH care pathway to prevent late-stage BPH, because that's a shared common goal. The ManVsProstate is really working at the grassroots level, trying to do direct to patient. We're going to try and launch BPH 360 in the spring equinox to really directly get the good information to understand that there's 3 things, right, that we talk about, the 3 Ps: prioritizing the preservation of bladder health, putting an end to the polypharmacy epidemic, and preventing late-stage BPH. Then on top of that, we're coming out, the EAU Incontinence Commission just put out a manifesto that they submitted, and they had key opinion leaders sign it. We're doing the same thing. Just saying, hey, this is what we think we get, and I get it too. Please understand, I recognize who I am and who I am not. I am just a small community doc in the desert.
You're more than that, man.
Well,
yeah.
But that's a truth. I do not have the academic experience and expertise of all the literature. We need everybody to chip in, but also really focusing on the patients. I do believe that hashtag, hey, what about my bladder? If patients are pounding, hey, what about my bladder? I know you're talking about my prostate, but what about my bladder? It's going to drive that change on multiple levels. So at least that's how we're hoping to get there, so that ManVsProstate manifesto, direct to patient education, right? Really having us talk about, just like here today on your podcast and other podcasts, how do we get there? And, also the publication that came out in the Journal of Nature, Prostate Cancer and Prostatic Diseases, that was huge. Really, to just give it a little bit of meat and authority that, hey, there's something here that we need to talk about. So that's where we're hoping, just changing the conversation, challenging the orthodoxy, and being willing to have that conversation. And I think the other thing is I want to bring up burnout and moral injury within urology. It's because we got away from being who we are, right? We're solution-finding surgeons. BPH is 30% of most practices' workload, but only 6% of their revenue. And it's also not fulfilling. We're not fixing problems. And we need to get back to what brings us joy as surgeons. And I think all those things, we start thinking about that, talking about that, feeling it, and listening to what I would call cognitive dissonance and resonance, what feels right, and letting that be our guide.